What a fabulous year for healthcare, and what a year for PCDC. At last we have major healthcare reform, something that we have worked for decades and decades and decades. And while you heard a lot about insurance reform, what you may not have heard so much about was the system reform provisions that are in that law. Those are the real ones that will make the difference in people getting the care that they need once they have that insurance. And that law positions primary care front and center, something that we have been working for throughout our lifetime. It takes serious steps to address the doctor shortage. It poses new models of care and payment that are patient-centered. And it poses a major expansion of community health centers. In fact, doubling the current capacity over the next 5 years, the capacity to care for another 20 million people around the country. We're delighted that healthcare reform has made primary care a priority. But healthcare reform will be what we make of it. And for those of us who are dedicated to getting good primary care into underserved communities, there's two tasks that we have to undertake. One is the expansion of capacity so that everyone has access to the services, not just the health insurance. And the second is transforming the model of care into what we know can be effective, can eliminate disparities, and can reduce healthcare spending. I'm very proud that PCDC, throughout its lifetime, has had these two challenges as its priorities. Expanding capacity, which we do through our capital program, making available the resources to build, expand, or modernize health centers, and redesigning practices and strengthening the systems so that we have high-performing primary care.